afternoon, I'm Fiona Walsh from DDS Architects. We're a specialist architectural firm, interior designers and advocacy group that design interiors for people living with cognitive and sensory impairment, and our particular area of interest is ageing and dementia.
Lovely. So we've been talking about lots of different things today. Five might be all about kind of promoting positivity in the sector and promoting kind of good practice, great practice, sharing ideas. Have you got any kind of low-cost innovations that people could implement immediately in their spaces, things that you find work really well in the homes that you work with?
I think we find that post-COVID our care homes, in particular long-term care homes, suffer particularly badly. And I think what we need to do is reassess our basic models in design. With regards to design, there are so many quick, easy, fast fixes. And when I say that, it's really about people being aware of the impact design can have, and understanding that within the care setting that people are triggered by things that you and I may not be triggered by. And I think it's really about educating a lot of maybe operators or staff to understand the impact environment has. Now, saying that, we can go right back to inception of design, where from the very outset of a project we can take inclusive design as one of the key driving principles, in which case we will get phenomenal outcomes. And obviously there's outcomes for the residents, there's outcomes for staff, and there's obviously outcomes for operators. But every building, whether it's new, refurbishment or planned maintenance, we can build in additional support for people to help them live more independently and obviously with less staff dependence.
I think it's really important is that as when you need to live in a care home, the small things really make a difference to your life. So not having flush points between rooms. So if you have them to move about in a wheelchair, it makes it difficult. Or wide enough hallways. Sometimes that's something that can't be fixed. But those little small things really make a difference, don't they, to people, especially when your health is at such a sort of critically important point in your life.
They do, but there are other things too. I mean, there's quite a bit of inclusive design knowledge out in the market, and I think we've literally just scraped the surface, or drop in the ocean of what's possible. And I think the really good news for operators is that we embrace the whole concept of inclusive design as a specialist area, and we really take it on board. We can make huge changes. I would say things like flooring, yes, absolutely imperative that we have, a clear tone throughout, and obviously blending thresholds if we have to have them, or seamless joints. But we need to take things like, say, falls. We talk about falls and we think it's about flooring, but actually it's to do with the whole cognitive load in a building. So somebody with a cognitive or sensory impairment, yes, the floor may be correct, but what else is going on in the building might distract them and cause them to fall. And I think it's taking it to the next level of understanding that will see the greatest benefits to the care operators and to the staff and to the residents.
So you're going to talk shortly.
Yes.
What's the topic of the talk? Would you talk us a little bit about that?
So I've been, the Shackletons Limited have invited me along on a panel. We're going to discuss care from funding through to fit out. And I think really it's a broad, there's a broad representation. We've got the furniture suppliers, we've got funding, we've got care home operators, we've got people who deal with the operational side of it and meeting, CQC criteria. So I think there's a broad view of where the market's going and what we can do to assist operators. But I think the positive news is, particularly from the design front, we've got massive advances we can make from where we are now, and they're not going to cost. I think the misconception in the market is that inclusive design needs additional funding and that it's going to affect the aesthetics. So people have images of, the old dementia units. That's not where we're going. We have 70% of people in all, not just in dementia care, but people in care homes, 70% to 80% actually live with dementia, diagnosed or undiagnosed. So we need all our environments in care to be inclusive and not just the dementia units. But the good thing is we now have the knowledge and the expertise, so we can design so we have beautiful interiors, homely, comfortable, no stigma attached. There's no sense of it being a special environment because to the untrained eye, it is literally invisible. We can do all of this and support people, and they can live in beautiful environments we'd want to live in ourselves. Yeah.
So if I'm a care home manager or an owner of a care home, it's probably not purpose built, maybe an older building, and I'm looking at a room and I'm thinking, is there anything I could do today, tomorrow, a quick tip to sort of help people make an improvement to an environment? I don't know, light, So I don't, yeah.
What I would say is the really quick fixes are probably visual and auditory clutter, and that's a bit of jargon. But if you think about somebody has to process every piece of information, particularly somebody living with Alzheimer's disease, which are 70% of people in our care homes, so they don't have any current new memories. So what I would say is if you look at the environment and think, right, it's all new to them. Every day it's new. They wake up and they're in a new environment because it's unfamiliar. They don't have that memory bank that the rest of us would have. So look at the environment and think, what would be the key things that they would have to look at and might, distract from task in hand or confuse? Is it quiet? Is it tranquil? Is it calm? So if you can think of what your Zen environment would be, try and create that for the resident. And if there's too much going on, we often talk about familiarity in design for care, and people think it's about doing retro, having zany wallpapers and retro furniture. It's not. It's about making it just comfortable and easy to operate in, so things that are intuitively done. So eliminate noise, eliminate clutter, be conscious that the tea trolley might be causing an issue, or next doors, the room next door, their TV may be too loud. And this will impact the resident. It may not impact us, and we may be able to drown it out, but actually that ability to focus on task in hand and drown out what's going on elsewhere is lost through dementia or cognitive and sensory impairment.
Someone living with dementia, like you said, if they're not creating new memories, like I'm sure that anybody watching this would know that if you go to a new place, it's very tiring, isn't it? Because actually what you're doing is your brain is having to process lots of extra information, whereas in most scenarios when you do the same thing day in, day out, your brain has captured the information it needs and it can reduce the cognitive load, can't it?
Our brain works on multiple levels, but the two main ones are procedural memory, which is things we do day to day intuitively. Like you can make a cup of tea and you walk in and sit down on the couch, you have no memory of doing it because you've done it intuitively and procedurally. Whereas if you drop the cup, you'll remember that because it's a working memory, so it's in the immediate and it's the forefront of the brain. So what we need to do is make things as intuitive and familiar and predictable as possible, so you're working in procedural memory. A bit like in a care home, I had a particular friend whose wife was in care, and she was quite long way down her diagnosis. And the most upsetting thing for him was she no longer washed her hands after using the toilets. And I was saying to him, we're trying to break it down and really to give him peace of mind. And I said, well, look, I think what would really work is if we put in all those cues and prompts that will assist her, so it becomes procedural. So she uses the toilet, she then stands in front of the sink, she can see the soap. It's not in a white soap dispenser on a white wall, and she can see the towel. So she'll do it because there's cues and prompts and triggers, and that's procedural memory. Whereas if she has to find the soap dispenser, which is not familiar, and she has to find the towel dispenser, it's not familiar, so it becomes overwhelming. So rather than partake in the activity, she then gets frustrated and agitated and goes back to her room without washing her hands. And it's the really simple things that can make such a difference. Now we can do large-scale infrastructural things as well, which will help hugely with, say, falls or incontinence or depression, apathy. We can build all these solutions in, but even within the existing environment we have, we can optimise what we've got, and I think that's the key message.
Lovely. So we've covered some big topics there. Well, I've got a really big topic for you. Toast. Yes. So we were having debate this morning at the Five and Right team at the breakfast table, and I said, let's have a bit of toast with butter and a bit of jam on it. And two of my team stopped and went, what do you mean butter and jam? And they said, just put jam on the toast. And I said, sorry, what are you talking about? Where do you sit on this? Butter, jam, or just
I'm
jam?
Irish, it's butter all the way.
Butter.
Forget the jam.
I think that would probably be a popular choice.
Yes.
Lovely. Thank you very much for coming to visit us today.
Not at all.
It's been great. Good luck with your talk, and we'll see you soon.